like always, our primary foci remain the same, which would be science, advocacy for our field, and training the next generation. So everything we do for those three will remain the cornerstones. I think additional things that have come along and I think have taken a sense of urgency or two. I mean, one, I think we will still be dealing with the pandemic for this year. And I think major part of this year will still go towards a lot of oxygen for pandemic management. I think lots of oxygen will be used for pandemic management and staying on top of things and providing guidelines. So I think that will remain a key part for this coming year. I would say an additional component which really came to the fore last year was the social unrest and the diversity aspects. And I think now there is, I think as an organization, we've always been very mindful of that, be it minorities or women representation. And I think as an organization, we've generally been pretty forward-looking on those funds, but I think it's given it a sense of urgency this past year, and I do think we will have some specific things rolled out towards enhancing diversity and inclusion, and really access is the third part as cell therapies start to explode. And access remains a new area for us to focus on, and we've been pretty active this past year on the Congressional Hill, trying to mold it in a way that it's accessible and it doesn't get lost in the usual bureaucratic insurance hassle world. And so I think that will remain, I think, a significant focus of interest for this year. So I would say, in addition to our core issues, the diversity aspect, pandemic, and access would be the three major things which will take up significant part of the time for this year.